Welcome to SurgiPod, the podcast that delivers you all the latest trends and developments from the world of surgical practice administration. Each episode, you will hear from thought leaders in the sector sharing their valuable knowledge, insights, and predictions from a range of perspectives. And now for your host, Justin Rockman, Vice President of Surgimate, the leading surgical scheduling and coordination technology provider. Enjoy the podcast.
I'd like to welcome Dr. Chima Ohaegbulam, who is a Section Chief of Spine Surgery at New England Baptist Hospital and a renowned neurosurgeon. Thank you very much, Dr. Chima, for joining us today.
Thank you very much, Justin.
Dr. Chima, please tell us a little bit about your own personal journey to becoming a neurosurgeon and the Section Chief of Spine Surgery. And I'd love to hear a little bit about that journey that brought you to where you are today.
A bit of a circuitous journey overall. I grew up and went to medical school in Nigeria. Mm-hmm. I came to Boston about 25 years ago for my residency in neurosurgery, specialized in spine surgery. And at the end of my training, I was looking for an opportunity to practice in a setting that had a robust multi-surgeon spine surgery program, and was fortunate to find one right next to where I trained. I trained at the Brigham and Women's Hospital and Children's Hospital in Boston, but ended up coming a few hundred yards away to the New England Baptist Hospital, which is a specialty hospital concentrating largely in joint replacements and spine surgery, as well as sports medicine. I've enjoyed practicing at a place that delivers very high quality special care to a large number of patients, and had always been interested in the logistics of how programs like this work, but admittedly had largely been on the sidelines for years. About a year ago, an opportunity came up when the previous chief of the section moved on to a new opportunity outside the hospital, and I thought it was time to see if I could apply some of my vision to maximizing our potential as a group with the strengths, the personnel, the resources we already had in place.
Excellent. And in terms of you being in that new position, what do you feel are some of the greatest challenges that you confront, both in terms of what happens within the hospital environment, but also in terms of healthcare in general in the United States today?
Certainly, I function in private practice myself, as do most of the surgeons at this hospital. But many of the challenges apply to employed surgeons, as well as to the entire healthcare system. The paperwork, the administrative burden of the care we have to provide is enormous. And it simply takes away time from actual patient care. There's only a finite number of hours in the day, and if X amount of time is spent on paperwork, that just leaves less time to deal with people.
So on our end, us as technologists and us on the software side, trying to provide the best value products and services, what is it that we can do to help you as a clinician, as a surgeon, provide the best level of care? What on the technology side can we help with?
Yeah, I think it always helps to have ways of decreasing the friction that is inherent in the systems we deal with. We deal with several different insurance companies, several different healthcare systems, a multitude of patients, and there are, there really is a nightmare of paperwork and technological systems to navigate in coordinating all of this for patient care. Reducing the paperwork, simplifying all of that is invaluable, and starts to give us time back with patient care, as well as just improving the quality, streamlining the work we do.
So it really falls very much not on the technology side, but also on the administration side and the support staff which you have. Surgical scheduling is a key component of that, being able to connect all the different stakeholders that are involved in scheduling a case together and making sure that it's a seamless journey for the patient. So what do you feel would be the the core ingredient that you're looking for, that you feel is critical to help make sure that that part of the process, the coordination of the surgery, is handled completely seamlessly?
You touched on a couple of things there. Being organized is paramount for a surgical scheduler, and along with that, having the initiative to deal with a complex schedule. I'm in spine surgery, for example, and the variety of cases that I deal with is pretty wide. There are smaller, less complex cases, and there are longer, more complex cases. Fitting all this into a schedule can be tricky sometimes, and having the ability to juggle varying requirements from different insurance companies, different times to get approval, as well as helping patients navigate their own schedules and commitments. To combine all of this in a schedule that works is a challenge, and it's an always moving process that requires a scheduler to be very organized and have initiative. And along with all of this is, simply being compassionate as well too. It's not pleasant or fun for patients to be in a position of needing surgery, and having someone who can guide them through this entire process, and soothe their frazzled nerves as they do so. Juggling all the other things I mentioned is very important, and it's quite telling when I'm meeting patients, for example, again on the day of surgery, and they're expressing gratitude to my surgical scheduler, as the main person they remember from the whole process, getting them through a very difficult process.
You use the term juggling, and I met once a young surgical scheduler who actually worked in a circus, and she said that my experience working in the circus is perfect for what I do as a scheduler, because scheduling a surgery isn't a linear process where this follows this follows this. It's much more like a juggling act, and if any one of those balls drops, or any one of those knives drops at any point in time, the surgery can get cancelled unnecessarily, and so that can create huge amount of frustration for the patients, for the physicians, and for the whole system. What in terms of frustrations, what drives you crazy, right, from the administration side of booking the surgery? When things get cancelled, or when the equipment rep doesn't show, what are the things that as a surgeon, it's like, if I could solve that problem, I'd love to be able to do that?
I think keeping track of the pre-authorization process is a big challenge for us. Making sure that we meet the requirements that different insurers have, and making that fit into the schedule for the patients and for us. That is a big challenge. If that didn't exist, for example, the process would involve less juggling, and it would become much more linear. But there are valid reasons for having a pre-authorization process, but because it is so complex and varies from one insurer to another, that makes it a very big challenge.
Right, and you've been a renowned neurosurgeon for many years. Have things just got increasingly more complex in the last decade to 2 decades from your lens as a surgeon?
Without a doubt, they have. It's it becomes more difficult with each passing year. The number of things that have to be taken into account with scheduling, the number of rules that have to be followed. So it is without any doubt becoming more complex with each year.
Right. So Let's switch gears first. I want to ask a question, as a neurosurgeon. Like the team here at Surgimate are completely obsessed with the Netflix show, The Good Doctor. So as is my wife, she sits there and binge watches it at night and whatnot. But when you're a surgeon and you watch shows like that, what's your reaction? Is this like completely outside of the scope of what happens in reality? How do you sort of react to the way in which surgeons are depicted today on television shows like that?
So I have to admit, I wish I had more time for TV this is not just as a function of work, but a pretty busy family life. I don't watch as much TV as I wish I could. I do get the sense from having seen some shows and from secondhand anecdotes that I think a lot of the time surgeons' jobs are, sometimes depicted as more glamorous than they actually are, or our lives are more glamorous than they are. That simply isn't the case for the most part, not among the people I know, and certainly not with mine. I also, from time to time see surgeons portrayed as mavericks, if you will, and that's rarely the case in my experience. Surgeons have to function as parts of complex teams, while they may lead those teams, the teams are completely dependent on them, on the surgeons working as effective members of those teams. Nothing works well if the surgeons are individualist, nonconformist. So the surgeon who is a maverick all the time is rarely seen in my experience.
Okay. So possibly outside of magically clicking your fingers and eliminating pandemics like COVID, what was it that you'd like to do? Like, if there was anything which you could do to help improve healthcare in the United States today, what is it that you feel would be the number one or two things you'd like to see happen?
I think at a fundamental level, there is a big disconnect between people's understanding of how healthcare is funded and the reality of what takes place. And that leads to a lot of the challenges that we deal with, a lot of frustrations patients have, and difficulties delivering care. So I wish it were possible to improve people's understanding of where their premiums, go, what the employer's contribution to premiums actually is, how those funds have to cover increasingly complex and expensive care. I don't know that a lot of people, truly grasp that resources are finite. People have very different expectations from health insurance, on the one hand, from what they do to auto insurance or home insurance. So it leads to frustration and unhappiness with the entire system a lot of the time. And I think understanding the entire picture of how healthcare is funded would facilitate discussions about whether society wants completely private healthcare or a government-run single-payer system or some hybrid model. I don't think society by and large has the information that it needs to make that decision. And so frustrations continue daily. Nobody is happy with the system as it exists.
So it's a combination of both the very, very high cost and also the lack perhaps of the transparency of information about what goes into the fact that there is such a high cost for healthcare. And that creates a lot of frustration. You can provide the highest quality of patient care on the clinical side, but is that matched with perhaps the value components on the financial piece that the patients get frustrated with?
I believe so. I think people just don't understand how the system works, and there'd be less frustration if they did.
So tell me a little bit about a patient that may have touched your heart and provided you with that sort of sense of satisfaction that you often go into when you decide to become a doctor, to give that motivation also to those that want to go along that very long, arduous task of becoming a spine surgeon, the many, many years. are there any experiences or stories of that one patient that you sort of have in the back of your mind that says, I'm doing all of this hard work and all these long hours, and that story really sits with you?
And there are a lot of patients like that. On the one hand, I'm not regularly dealing with trauma patients or patients with life-threatening issues, but the quality of life issues that come up day to day with what I treat is very important for many people. I was talking with my wife recently about a wonderful woman I treated several years ago who was a nun in a convent, and as part of her mission, she was a very accomplished organist, and had gradually lost the ability to play the organ because of her spinal condition. Underwent surgery, had a somewhat challenging recovery, but ultimately recovered her ability to play. And the joy it gave her was incredible to see, and it was very, very gratifying. She was insistent for the longest time at pulling me and my family over to the convent so that she could perform for us. And my kids, I had very young kids at the time who were tickled to see the attention given to all of us, and the joy and gratitude that she and her entire community had over that restoration and ability that she had. I'll always remember her, and there are multiple people like that who have just lost the ability to engage with family members or community that get that back, and it fulfills them, and it's very gratifying to see.
Oh, that's such a beautiful and touching story. Thank you very much for sharing, Dr. Chima. And the work you do is magical. It's unbelievable. Thank you so very, very much for your time today and joining us today on SurgiPod. And I know you have an extremely busy schedule and a lineup for today. And once again, just thank you very much for your time.
Thank you very much, Justin.
Have a great day.
You too.
Thank you so much for listening to SurgiPod. We hope you enjoyed this episode. Remember to subscribe wherever you get your podcast to stay up to date with new episodes.